Thanks, Professor Beard.
Thanks, Kathy, and thank you for inviting me to speak today, and welcome to all our honoured guests. I will proceed, hopefully, straight into the material. What I want to do today is really use this as an opportunity to take a stocktake of where homelessness is in South Australia. My central argument is that we have been through a period of reform for a little bit more than 13 years, so we'll say 15 years. We've had fundamental reform, fundamental change, new investment in the homelessness sector. And I guess we don't often think, well, where have we landed? What has happened? What have we achieved? What haven't we achieved? What are the missed opportunities? And perhaps most importantly of all, what's next around the corner? What's coming towards us, and how should we be thinking about that as a sector, as a homelessness service? So I want to talk about understanding homelessness. I want to talk about 15 years of change. And I want to spend most of my time really talking about the reform process and what the outcomes of that reform process are, because I think to date we really haven't talked about that in any systematic way. And one of the things that I know from my fringe involvement with the health sector is that they always talk about outcomes, and it's their discussion of outcomes which provides leverage when they talk about, or when they talk with the public sector, when they talk with politicians. It's being able to demonstrate outcomes and demonstrate what works and what doesn't work that really makes a difference. And then finally, I want to think about the future and where we've landed. So what do we know about South Australia? Well, we know there's a significant problem of disadvantage in Australian society. That's not news to anyone. We know that there's a significant problem of homelessness in Australia, but we also know that South Australia faces special conditions. Some of those special conditions focus on the fact that we have an older and poorer population. We have a population which traditionally is focused on the manufacturing sector, on relatively low-waged employment. We haven't seen growth in the financial services sector, or really the services economy overall. And there are many, many people within South Australian society who are fundamentally vulnerable and at risk. The difference between being homeless and being homed for far too many people who live in precarious housing, is paper thin. Recent work by Wendy Stone from Swinburne University talks about the resources and vulnerabilities people have to critical life events. For many South Australians, those resources are very, very few, little capacity to adjust. So in many respects, South Australia provides an example of how a population can be more at risk to homelessness. And we know that some of these processes leading to vulnerability to homelessness are beyond the control of our population and even our state government, including things such as the arrival of refugee arrivals into our state, something we should welcome as a community, but a population group at risk of homelessness. We also know the data. We've all discussed the data, we've all debated the data, we've all argued against the data on how many homeless people there are in Australia at any one time. And that's an important point. Now, one of the important things I think here is that the ABS data provides the best estimate we currently have of the homeless population. And in many respects, South Australia does well. We haven't seen the growth in homelessness that has been evident in other jurisdictions around Australia. So that's very good news. And we have one of the lowest rates of homelessness across Australia, but it's still unacceptably high, and potentially the risk of growth is substantial. We then need to think about how we've gone through a process of change and what the 15 years of reform and consideration of homelessness issues has meant for the state. And of course, really the point to acknowledge is that it started with the election of the Rann Labor government in 2002 and the establishment of a social inclusion board to drive policies of change, to develop an agenda of inclusion really based intellectually, I suspect, on the Blair Labor government in the United Kingdom, and looking at a number of issues which touch upon homelessness as well as addressing homelessness directly. So while homelessness is one of those issues that were a foundation priority, issues of drug abuse, Aboriginal health and wellbeing, youth offending, mental health and disability services, that's all in the ambit of the discourse and the debate around homelessness. So a very important set of initiatives. The Social Inclusion Board noted the commitment to reduce homelessness by 50% over the life of its term, and it developed a three-phase strategy: preventing homelessness, intervening early, minimising the length of time people spent homeless, and improving the integration and coordination of services. Effectively, the South Australian Strategic Plan, or I think that's the final term they used, committed the state to halving rough sleepers in the state by 2013. But in 2012, the Committee of Audit concluded it was unclear that this goal would be achieved. So, in many ways, it could be argued that the state government's initiatives were running up a down escalator. Change happening in broader Australian society, change happening in the economy, government processes were in many ways making it very difficult to meet that target. And I suspect there's also a very substantial hidden reservoir of persons who are in precarious housing who are always at risk of falling into homelessness, and as you begin to meet some demands, other demands become expressed or emerged. And that's an issue we need to think about. It's not just people homeless or at risk of homeless as formally identified by services, it's this precarious population who are vulnerable of falling into those categories at very many points in time. We then went through a process of the federal government, through the initiative of Kevin Rudd, also engaging with the homelessness agenda. And the Rudd government introduced, as we would all know, both a green paper and then a white paper process, which in many ways, I think, borrowed on the intellectual traditions of the South Australian government and policy initiatives, including the work of Monsignor Capo. Three key strategies: turning off the tap, expanding services and breaking the cycle of homelessness, and focusing in particular on three key groups listed here. Good policy initiatives, an important investment in the homelessness sector, and an important substantial intellectual contribution to our understanding of homelessness in this country. So the debate around housing first really can be traced here to South Australia and then spread nationally through the Rudd government's initiatives. So I just think I missed a thing. No, didn't. So reform, new engagement by the federal government provided additional resources to the National Partnership Agreement on Homelessness, which in turn led to a new commitment to reform of the sector, signed off in 2009, but to the best of my recollection, largely implemented from 2011. And individual initiatives are listed there, and I'll only touch on them very briefly. What we saw really through these reforms was a greater emphasis on what was understood to be best practice, including formal case management strategies and development of plans for homeless persons, greater investment into areas of key need that were identified, and I think many people would agree with those priorities, a greater focus on regional consultation, and then a formal process of engagement with the sector by government through HSG and Homelessness Strategic Group, of which I will admit to being chair, and the introduction of the H2H data collection process, so that all of a sudden, as people were approaching services, they'll be required to service workers will be required to provide information, and there'll be a sharing of data so people didn't have to tell their story more than once. We also saw the introduction of a gateway service, and we also saw the introduction of a number of other initiatives which are very important. The thing is, change happens. We all know that change happens. We all know that change is an important and inescapable feature of both our community life and our world of work. One of the key questions I think it's worth asking in 2015 is, what have been the impacts of these change? Have they been positive? Have they generated better outcomes? Or have they been no change, which is often the most likely outcome from a reform process, or have they had negative impacts? This issue was first addressed in roughly 2013 by a report commissioned by HSG through the Social Ventures Australia. And their research, based admittedly on a very small number of case studies, but also a review of the policy process and in discussion with service workers, found that there were substantial outcomes as a result of the reform process for individuals. Not necessarily the sector as a whole, but for individuals. And these included better systems for case management, a greater number of persons in supportive housing, fewer people turned away from homelessness, more individuals assisted, improvements in service quality, and a higher level of collaboration between providers and greater accountability in terms of the services provided to the community. These are good things. These are generally positive things. They anticipated other benefits to emerge over time, but basically pointing to a much more efficient, much more effective sector, better able to meet the needs of the homeless population, which fundamentally is really what we're all about. How do we best help the homeless population? Their analysis suggested that not only did these reforms deliver more, so providing more higher quality services to the homeless population, they actually saved government or the public sector expenditure significantly as well, generating savings they estimated at roughly $20,000 per individual assisted. These aren't small savings, I should add. So Social Venture Australia provides one lens by which we can examine change and the impacts of reform. DCSI data collected through H2H is now available and is now published on a somewhat regular basis that provides other information on the sector. And the most important thing is we now have a sector which we can demonstrate is operating at scale. We know we can demonstrate it's providing significant numbers of services to a significant number of people. So 29,000 periods of support to 22,832 individual clients, many of whom are very, very vulnerable people, including 14% of the total client base aged under 9. The first time I read that, I was so confronted by it, I didn't believe it. And then I looked at other data and thought, yes, of course, Andrew, you're silly. That is the truth of it. It's women fleeing violence in the home, bringing their children with them, and other very vulnerable individuals. The sector as a whole provided 29,000 instances of support, but in terms of individual interactions between agencies and individuals, there were almost 40,000 individual interactions between agencies and individuals over 2014-2015. That is a substantial number of interactions, and to me it tells me that the census count on homelessness is a massive underenumeration of what's really going on. They're saying 6,000 homeless people. Are these 6,000 homeless people on average having 7 interactions with the homelessness sector? I don't think so. There's something else going on and it's not being acknowledged and recognised. And of course, the census count to a certain degree drives the funding decisions of governments, in particular federal government. If nothing else, it provides scope to those, it provides a sense of the scale of the problem so that resources are either allocated or not allocated, and at the moment we could argue they're being misallocated. The other important point is that the data shows that the sector is now providing services to those in the greatest need. 35% of those seeking assistance are doing so because of domestic or family violence, 25% affected by mental health, 28% were already homeless when they sought assistance, and 3% had a non-psychiatric disability. This is a very vulnerable population. This is a population with multiple and rather confronting challenges in many instances. Significant number of presentations by people from Aboriginal and Torres Strait Islander backgrounds, significant demand for support, and while the sector is now more effective in providing assistance to people, we still had roughly a quarter of all people who came to a service looking for long-term accommodation get turned away from those doors without any help. That is a confronting statistic. That tells us our system is not currently meeting needs. Doesn't mean that our services aren't good. It means our services are overstretched, and then something that exists beyond overstretched. They're completely at capacity. Other data from DCSI, the H2H database, tells us that the formulation of best practice actually works. Their most recent analysis suggests that rough sleepers who received a formal assessment were more likely to exit from a service into sustainable housing, less likely to exit into housing that is not sustainable, and less likely to exit back into rough sleeping than those who did not receive an assessment. The same relationship was evident and was statistically significant for rough sleepers who received a case plan, and appeared to also apply to other service seekers who received these forms of support. Critically then, what it tells us is that one of the key features, and perhaps one of the debated features of the reform process, is having an impact. We now have a database that tells us that reforms that were introduced at that time actually have a significant impact. But it's also important to acknowledge that change has come at a cost. This whole sector reform process has come at a cost for the sector. Change brings about friction. We all know that, but in reality, this means it's friction imposed on organisations working on very thin margins with very few resources, trying to meet the needs of a very vulnerable population group. The focus on the preferred providers that was introduced from 2002 onwards has been controversial at times because it means there have been both winners and losers. H2H as a data collection process has been controversial because it's another impost on frontline workers, because it can be a challenge getting data from people with mental illness who are presenting to a homeless service, and there's questions about how that data is used in the longer term by government. There's also been a concern around the potential, if not the reality, of a target and audit culture associated with this sort of innovation. This is one of the critiques of the social inclusion initiatives by the Blair Labor government in the United Kingdom, that effectively once you set targets and once you start to set these standards, you lose sight of the big picture, which is about helping people. So we need to acknowledge these critiques. So I now want to finish off by talking about where I think we've landed. Well, I think where we've landed is a sector that we can now demonstrate is incredibly lean. And when I say demonstrate, I think it's always been very lean, but we now know just how lean it is. So it's estimated by the state government that in 2015, state and federal outlays on homelessness service will total roughly $57 million. To put that into context, the recent fleet announcement by Prime Minister Abbott was $89 billion. Now, obviously that was over a number of years, but we're talking about a very, very small part of public sector outlays. The state government alone spends $6 billion. So we're talking about a fraction of outlays. It's a very small outlay. This $57 billion supports roughly 40 organisations, 4 government, 36 non-government, with 96 agency outlets. If we do the very simple mathematics and divide total outlays by the number of services provided, each sector-wide support costs roughly $1,931, but each individual agency interaction costs about $1,400. Now, to me, that's not much. In fact, that's parsimonious in the extreme. This tells me we've got a sector running on a shoestring, because this includes an enormous range of supports that people are providing, including accommodation, and accommodation is not cheap, as we all know. But is lean good? In new public management theory, you often focus on developing targets, developing performance monitoring, and achieving those outcomes as quickly as possible and efficiently as possible. But is lean necessarily good in this sector? We have a tsunami of industrial change coming our way, and we know that as the South Australian economy goes through shock after shock over the next 2 to 3 years, it will be the vulnerable who will be most affected. It'll be people at the bottom end of the labour market who get shuffled out, and it'll be the children and the partners of people made redundant who will actually be forced out of their housing for a variety of reasons, including domestic violence, and forced to look to these services. And we've already got a small, lean sector with no capacity, no spare capacity to meet additional demands. So my concern is that we've landed at a point where we've become efficient, but we're not large enough or sufficiently well-resourced to cope. Sorry, not too far. I think also we need to recognise that fragmentation remains an issue for the sector as a whole. the sector, homelessness is a community service. The community services sector, but particularly the homelessness sector, has its origin in the community. It bubbles up from the ground, and it's over recent decades it's been formalised. And that process of formalisation has resulted in some degree of consolidation, but not a great deal of consolidation. We have many players in this field. We've got philanthropic organisations, non-government organisations, local governments, advocacy agencies, faith-based bodies, etc., etc., etc. I often drive through the city or walk through the city and I find another organisation setting up a soup kitchen for the homeless population or providing some other form of ad hoc assistance. This fragmented nature of community organisations engaging with this set of issues is small scale but has an aggregate impact which we often underestimate and need to think about more systematically. If we were more integrated as a sector, if the homeless services were more integrated and more active in drawing out the resources of community organisations on the fringe, but with a real interest in this space, we would probably get better outcomes, we'd have more resources, we'd have greater achievements. We also need to acknowledge that fragmentation has in part been institutionalised. It's been institutionalised because as we've moved to a new public management model, we contract out services, or governments contract out services, so collaboration between agencies becomes near impossible. You know, if you want to talk about conflict, talk about the relationship between the Flinders University, University of Adelaide and the University of South Australia. We just don't talk. It's silly, it's wrong, and why reproduce that level of institutionalised distancing in a community sector which is focusing on the needs of the most vulnerable populations. And we also now have a sector which is very vulnerable to shifts in government priorities. Homelessness is a long-term problem. My colleague Paul Flatall from the University of Western Australia has written a number of papers which I think many people here would be aware of, talking about homelessness as an intergenerational phenomenon. So you inherit it from your parents in many instances. Your early adult experiences shape your propensity to become homeless. That's a long-term issue. But we have 1 year, 2 year, 3 year funding cycles, 4 years if we're lucky. Talking with homelessness sector organisations, they were grateful that NPAR got a 2 year extension. It seemed so good. But that's ridiculous. Surely we should be making commitments over 5 years, 10 years in terms of addressing these issues. And it's only through these longer term commitments will we ever really begin to address these questions in a substantial way. As has been mentioned by other speakers today, we also need to acknowledge that there is a real risk that shifting political priorities, shifting political foci will also see resources directed away from housing and homelessness as a activity of the federal government in particular, resulting in a decline in the services available in this state. And that will be a tragedy for South Australia, particularly in the face of this tsunami of additional demand I've talked about before. The Honourable Scott Morrison gives us some hope with his view of compassionate conservatism about what may come in the future in terms of re-engaging with housing and homelessness. I think part of the challenge for the sector is to make sure we remind him of the importance of these issues and the impacts on the lives of individuals. So my final thoughts are really partly for the sector as a whole. The process of reform, I would suggest, has been a good example of new managerialism. It's about performance monitoring, professionalisation, introduction and mandating of best practice. On balance, I think these are necessary evils because what they do is they give the sector now the information, the resources and the professional standing it needs to make sure it can make a credible case to government for additional resources and also make a credible case to the broader community for additional resources. Because the answers aren't all lie in government. What the community does is going to be important also. In some respects, I think the sector needs to lean into the change, and I'll confess I stole that from one of my colleagues on HSG, and identify which elements of this reform process could best benefit it. For me as a researcher, it's clear that the H2H data provides an almost never-ending opportunity, if they gain access to it, to demonstrate the effectiveness of their interventions, to identify the effectiveness of their action, and to identify continuing, ongoing and acute need for homeless services. I think we also can never lose sight of the fact that currently resources for homelessness services are very, very modest at best, and we need to be engaging as a sector in broader debates around other forms of innovative financing, including some of the discourse that Scott Morrison and others are using within Department of Social Services in Canberra, but also the broader debate around social impact bonds. Innovate and survive, stand still and fall behind, I think is the motto there. We can't ignore the impacts of economic change, and that should be part of our discussions with the community, part of our discussions with government as we look to the future. And finally, let's think about what the benefits from greater coordination across the sector and also with other parts of the community spectrum would look like. We need to think about how we engage with those agencies, community organisations, etc., that would like to see good things done for the homeless population, would like to make a difference in our society, but don't know how to do it and don't have the skills to do it. The people in the sector have the knowledge and the skills, they just don't have the resources. Let's see if we can free up those resources and then apply them through the sector. Thank you very much.